The title of this talk is Mycotoxins Production and Immunity. One of the key things I wanted to cover in this talk that might be a little bit novel to many of the attendees is just talk a little bit more, do a little more of a deep dive into some of the immunity situations that arise with with different toxins, specifically in this case mycotoxins. We'll talk a little bit about. So I'm supposed to keep this to 30 minutes, so I'll try to go through this fairly quick. There'll be some of this is going to be a review for the attendees, so I'll try to go through it real quick, just not to waste any time on stuff that most of the attendees I'm sure are very in tune to and up to speed on. So my name is Simon Timmermans. I live in Ames, Iowa, and I'm part of a group called the Veterinary Research and Consulting. It's based out of Hays, Kansas. We do a fair amount of beef and dairy consulting work in the Midwest to the West Coast. I want to say, first of all, it's an honor to speak to this group. When I was in grad school back, 20 years ago, we were doing a lot of corn silage processing research and different things. And when I wrote my thesis, there was a lot of stuff that I pulled from Penn State researchers. And so I've got a lot of respect for Penn State as an institution and the contributions that they've made to dairy nutrition and certainly in my career. So again, it's a real honor. As with many talks, we certainly, when we put these talks together as speakers, we get certainly some help from some other people. So I just want to properly credit two individuals. First of all, Dr. Steve Ensley has been kind of a good friend and mentor of mine. Steve used to be at Iowa State at the toxicology lab there. And I did some work with him, some graduate work, and we published some stuff we'll talk a little bit about later. So I certainly want to credit him for providing some of the information for this talk. And then also Mary Beth Hall, you'll recognize, I'm sure many of the attendees will recognize some of the pictures, especially regards to gut health. So just want to make sure she's properly credited as well. The objectives of the talk, a few things. Number one, I just want to go a brief review, as I spoke earlier, just review the differences, the key difference between mycosis and mycotoxicosis. There's a difference there, and we'll talk about that. Review the key mycotoxins that we run into here in the U.S. and go through as a review the effects on dairy cattle. Again, most of the attendees, I'm sure, are up to speed on this, so it's going to be a review. Thirdly, we're going to characterize some of the immunosuppressive effects of these mycotoxins in the animals. And then finally, the last part of this talk, I just want to spend a little bit of time talking about other potential toxicities that sometimes may be overlooked, that just want to make some of the attendees aware of, I think may be helpful. So we'll start there. Before I get started, I just want to introduce the attendees to a gentleman here. His name was Paracelsus. Paracelsus was a gentleman that lived about 500 years ago, about the time of like Da Vinci, Martin Luther, during that time period. And so he was actually a physician, and is considered today as probably the father of toxicology. And his great quote that he said is, "It's not the poison, it's the dose. The dose is the poison. Anything can be toxic at the right dose." So I'll lead off with that. So Paracelsus. Before I also get started, I also want to, and this will be in the notes, this is a good review. If anybody wants to dig a little deeper in probably the most up-to-date research, comprehensive they call it the silage review. This publication, the Journal of Dairy Science, would be a great place to go to just get up to speed on the most up to date prevention strategies, management strategies, with different binders and absorbents that are out there. So I'm going to refer you there because I don't want to spend a lot of time on this. So here you go. This is from 2018. So let's start with molds. Again, as I think most of the attendees would know, there's different types of molds, many molds. Some are toxin producers and some are not. And so in the toxin producers, you'll recognize some of those names: Aspergillus, Fusarium, the big ones that we run into here in the US. And then there's non-toxigenic. They're molds. They are certainly can create problems. but it's different. It's a different way they create the problems. They don't secrete the toxins. So some of those you might recognize. Mucor as a species of molds that we typically define them as bread molds. Trichoderma, strichobatrosis is, I think I spelled or pronounced that right. Those are two common house molds. Again, you'll see that in situations where there's flooding and homes get flooded and there's mold in the homes. It's not good. It's a bad thing, but it's not because of the mycotoxin. It's more because of the mycosis, the spores that get inhaled or get into the environment. So toxin producers, non-toxigenic, non-toxin producers. Okay, so when it comes to molds and disease, this disease syndrome is called mycosis. Okay, it's the disease caused by the actual mold itself. I think it's an actual infectious disease. So if you think of molds causing mycoses, there's a number of different diseases that we've seen. A couple of them in the companion animal species, especially in dogs. In the Southwest, you'll see a situation where dogs will get diagnosed with coccidiomycosis, and that's just a mold in the environment in the desert Southwest. It gets in the lungs, and it's called valley fever. In Ohio River Valley, there's another fungal disease that dogs will commonly get. This is can be inhaled or actually ingested this time, and it goes systemic. It's a mold. It goes systemic. It's invasive, and it causes a disease called blastomycosis. Both of these diseases are not easy to treat, if at all. So generally, it ends up being fatal to the animal. More specifically to agriculture, people handling moldy corn, farmers lung, again, that inhalation of mold spores. Respiratory disease is the most common. It's the spores that get inhaled, get access to the organism, and then they invade. On the oral side, there's hemorrhagic bowel syndrome in dairy cattle. There's a mold called Aspergillus fumigatus. Folks are probably aware of that. That's been tied to causing that bloody gut syndrome in dairy cattle. So again, that's a mold causing disease. It's not a mycotoxin, it's the mold. And then also there's a couple species, Aspergillus and Mucor specifically, that I would share with you that can cause these later abortions in cattle. It goes systemic, it's in the blood, and actually creates a inflammation of the placenta, placentitis, that creates a what they call a mycotic abortion. Now you contrast that with mycotoxicosis. Now we're talking about the molds that secrete the toxin. The toxin causes the disease. Again, there's many known toxins, hundreds of them. There's maybe a few dozen that we would actually know something in depth about. I probably less than that. There's just very few that are well characterized, specifically in dairy cattle. So mycosis, mycotoxicosis. Just a couple pictures here. These are pieces of lung that came out of an animal that was suspected of pneumonia. The lungs certainly, upon autopsy, looked like pneumonia. Interesting thing is we actually grew mold out of it, not bacteria. So that's a mycotic BRD, bovine respiratory disease. And then here's a situation where a liver was plated out, and it also grew mold. So again, these molds, these spores can get invasive. They can go systemic and create disease. Now, let's talk about ruminants in particular when it comes to mycotoxicosis versus monogastrics. Common question is, are mycotoxins degraded by rumen bacteria? The answer is yes. Many of them are. That's a good thing for the most part. So this would explain why ruminants are typically more resistant to mycotoxins than the monogastric food animals such as swine and poultry, for example. So aflatoxins, the rumen stability of aflatoxins, rumen bacteria will actually convert them to aflatoxicol. So they don't necessarily, in fact, they don't detoxify aflatoxins, but ochratoxin, largely detoxified. Fumonisins are pretty rumen stable. Vomitoxin, largely detoxified. Again, that's why ruminants are a lot more resistant to vomitoxin. Zearalenone, there's a conversion to alpha zearalenol. Then you got the penicillium toxins. Research isn't really conclusive what happens to them. And then you got the ergot alkaloids, which are very stable in the rumen. Ergot, this is like fescue. See, this is more of a beef cattle situation that we run into in beef cattle in certain areas of the country where they graze on fescue during certain times of the year. Common mycotoxins, again, review. I categorize them into 3 different families from whatever mold family they come from. That was kind of the easiest way that I've always been able to think about them. So out of the Aspergillus family of molds, the 2 big ones that we see in the labs, we see a lot that we're testing for is aflatoxin and ochratoxin. Fusarium, that Fusarium family, they produce a lot of different types of toxins as well. One family or one group of toxins are the trichothecenes that come out of Fusarium, and in that group is the 2 most common or well-known ones are T2 and vomitoxin. And then we got zearalenone and fumonisins that come out of the Fusarium family of molds, and then penicillium family, mycophenolic acid, and O14C are the 2 that we typically would run into out of the penicillium molds. So going in specifically, just to review the different mycotoxins, aflatoxin, key thing, it's very toxic. And what I mean by that is when we say very toxic, the toxicity of aflatoxin is typically measured in the parts per billion range, ppbs, not ppms, ppbs. There's feed limits. It's regulated by the FDA because it does pass through into the milk. The reason why it's important is because aflatoxin has been has carcinogenic properties, and so if it gets into the human food supply, it will create health issues in the consumer, human consumption. 100 parts per billion has been shown to be toxic to beef cattle. So again, pretty toxic. It mainly affects the liver. So it's absorbed. Remember, it goes through the rumen. It's doesn't really get detoxified in the rumen at all. It gets absorbed, and it ends up getting into the hepatic portal system, ends up in the liver, starts to create damage to the liver. The carcinogenic properties of it alters DNA structure and replication. And so some of the biggest effects are seen in young and fetal, in utero, more in those growing animals more than adults, simply because there's going to be more DNA replication, more cell division. So there's more chances of that replication process to get disrupted. Now, digging in deeper on the immune suppression side, because the main organ damage is the liver. The liver is a big organ in protein synthesis, regulation, metabolism. So it has an effect on both humoral, meaning the antibodies, that arm of the immune system, as well as cell-mediated, which is your innate immunity that you're born with. So the research shows that it suppresses T and B lymphocyte activity. And it also suppresses Ig and antibody production, which we believe is probably tied to as a secondary effect of the liver being damaged. Some liver damage there with aflatoxin. There's a nice picture of what liver should not look like. This is not healthy liver. That's an enlarged liver. You notice the color is orange. It's pale. It's not a nice dark red. And you see the rounded edges there on the top, right there. You can see those rounded edges. So there's a lot of scar tissue and fat deposition in that liver. And so again, this is one of the sequela, the after effects from long-term exposure to some of these mycotoxins, in this case aflatoxin. We'll talk about this later, but this is, as many of the attendees would know, this is not the only thing that can cause liver problems. So just keep that in mind. Let's talk the trichothecenes. The big one here is T2. Again, with T2, it's very toxic. Toxic levels measured in parts per billion. There's some research, for example, specifically that showed 640 parts per billion was the toxic level. But obviously, it depends on a lot of different other factors as well. But just remember that aflatoxin and T2, the toxicity is measured in the parts per billion. So it's a bad toxin. Now this one, this toxin has some real irritating and necrotizing effects on mucosa and skin. Necrotizing means it actually kills the cell. And so you get that in the guts, you're going to get some pretty severe gastroenteritis, intestinal hemorrhage. So you're going to see some bloody gut, and then also reduced immunity. The mechanism for immunosuppression is believed to be reduced protein production. Specifically, there's a syndrome called radiomimetic syndrome. What radiomimetic means is it mimics the effects of a radiation treatment to a cancer patient. Okay, and so if you think about cancer patients, they're always checking your blood cells, your blood counts, and it's the same deal, is that it suppresses the production of those cells. And so in T2 cases, you'll see pancytopenia, meaning that all the blood cells, white blood cells, red blood cells, platelets, are all going to be low. You also see diarrhea, which is typically tied in with that. With that protein alteration of protein metabolism, you'll see diarrhea as a secondary effect. And then you're also going to see this situation called lymphoid depletion. Understand in the GI tract, there's a lot of lymphatic tissue in there. Specifically, they're called Peyer's patches. And that's an area of the small intestine that has lymphoid tissue. And that's important to immunity because that's the area, that's the front line of the immune system being able to detect something invasive or infectious that has been ingested. Okay, so that's where that's the front line of the immune system. And so the T2 toxin will wipe a lot of that out if it's at the right dose. So again, irritant, necrotizing, it's hard on the GI tract, it's hard on skin, epithelial tissue. And the last thing I want to mention is it reduces the chemotaxic migration of neutrophils. And what that means is that it begins to alter the cellular communication between the white blood cells that tell white blood cells to migrate to areas of infection. It alters that. And so you don't see the white blood cells going to where they need to be when there's an area of infection. Okay. So that's the other thing. That's innate immunity. It alters that effectiveness of the innate immunity. Okay, so again, this Mary Beth's photo here that's been used, I think, quite a bit, that shows diarrhea in dairy cows. So again, there's a lot of things that can cause manure to look like that. T2 is one of them. So keep that in mind. But remember that T2 is pretty hard on the GI tract at the right dose. And so you're going to start to see mucin cas. And again, you'll start to, she actually washed some of those pieces of tissue off, put it in a cup. So that's the lining of the small of the intestinal tract there. And those are called mucin cas. It's like a snake shedding its skin. And that comes from an insult to the GI tract. Again, there's other things that can cause this. T2 is one of them. Let's switch over to vomitoxin now. This mycotoxin is best characterized in swine. It gets its name from swine. Actually, it triggers an emetic response, makes them vomit. So this is not as toxic. It's actually, the toxicity is measured more in the parts per million range. The clinical signs in dairy cattle has been reduction in intake and milk production, which probably go together, and laminitis. Beef cattle can tolerate up to 21 parts per million. They're going to be more tolerant of it than dairy cattle, typically. The key thing to remember with DON is that it's commonly used as a marker for other mycotoxins. A lot of the research just using pure vomitoxin dairy cattle really didn't show a lot of toxicity. So a lot of times we figure that there's other toxins along with it that we just probably aren't testing for, or we don't know much about. Now, from the standpoint of immunosuppression, the studies in pigs show that vomitoxin, it necrotizes or kills The cells lining the small intestinal. In this particular trial, it showed in the jejunal region. It reduces the villi height, so it actually reduces the surface area for absorbing nutrients. So it's probably a lot of it's a surface area effect. And then that same study showed that it decreases energy digestion. In this case, it was they showed a specific response to reduction in fat digestion. So that's where we probably would see a similar mechanism like this in dairy cattle, which is what would explain some of the drops in milk production. Okay, zearalenone. So this is also from the Fusarium family of molds, but it's not a trichothecene. So it's a different group. Remember the T2 and the vomitoxin; those are the trichothecenes. Zearalenone is in a different category. What makes zearalenone unique is that the reproductive system is the number one set of organs or organ affected. Okay, it tends to alter hormonal function. It has a chemical structure that's similar to estrogen, and also it has a chemical structure very close to zearalenol. Zearalenol, it's just one little chemical change away from zearalenol, which is interestingly enough the compound used in Ralgro, which is the growth implants that we use in the typically in the beef side for grass-fed cattle. It's real low potency growth implants. So again, it's got hormonal effects, which also would lead to a lot of these clinical signs I listed up on the top there with restlessness, udder enlargement, hormonal effect, decreased milk production, excessive vaginal discharge, enlarged vulva, again, hormonal effect. EED, early embryonic death, so you're going to see some reduction in reproduction, continual heats. Big one is cystic ovaries. So those are the big ones that we see there. Are hormonal effects with zearalenone. It's not as toxic. In the case of dairy cows, 500 milligrams was shown to cause cystic ovaries, a little bit less than heifers. So it's not as toxic as some of the other ones that we talked about. Okay, switching over to the Penicillium family. Interesting though, so Fusarium is considered a pre-harvest mold, grows out in the field. Typically we see this, if there's been some drought and some big alterations between drought and wet conditions and cold and dry conditions. I mean, I'm not an agronomist, but certainly it stresses the plant and it creates the opportunity for these molds to grow. Penicillium is a little different. This is considered more of a storage mold. And what allows that is that Penicillium has a little more tolerance to low pHs. And so it grows in silage. Even silage has been put up pretty good. It actually can grow in some of those low pHs. So Penicillium family, typically think of that as more of a storage mold. And so, we typically see it more in fermented forages. And it's more well characterized in the EU. I think partly because there's just a lot more ensiled forages and a lot less dry grains available in the EU is just my hypothesis of why that would be. But getting in specifically, mycophenolic acid, again, from an immune standpoint, decreases the proliferation of the production of T and B lymphocytes. So it's been shown to do, it decreases the activity of cytotoxic T cells. So that's innate immunity or cell-mediated immunity. So again, it affects both the humoral, the acquired immunity, and the cell-mediated immunity, which is your innate immunity, the part of the immune system that you're actually born with. So that's mycophenolic acid. And then the other one that's in this family is Roquefortine-C. So again, it's out there. I don't have a lot of experience with these two, quite frankly, but it certainly they're in play in that Penicillium family. Okay, so now let's switch a little bit over to how to diagnose mycotoxins. This is where a little bit of the art of nutrition comes into play, in my experience. Number one, it's difficult. There's no smoking gun, quick, rapid test that you can use to conclusively say, okay, we got a mycotoxin problem. It's not that easy. The reason why is that the symptoms are non-specific, and they can be related to many other problems. Okay, for example, I always use this example is poor fertility, poor reproduction has many causes in a dairy, and usually you start with something with the first and the last name. You start there, and then you work down. So, you got to be careful of blaming everything on mycotoxins. It's easy because mycotoxins is a lot of times it's a big black hole. I use the other example, stray voltage. I mean, there's no question stray voltage is real. It can be incredibly detrimental, but we got to be careful we don't just automatically go right over to stray voltage rather than doing our due diligence as professionals, veterinarians, nutritionists, and ruling out all the other things too. So, that's, I'll just leave that there as just something to think about. The key thing I want to make sure the folks understand here is the difference between clinical versus subclinical. All right, so we think of the iceberg effect. The water line. The iceberg that we see above the water line doesn't represent what's underneath the water line, and the ice that's underneath the water line a lot of times is a lot bigger than what's above. So that's what we can see is the clinical signs. That's a clinical disease. So the symptoms are visible. Aha, we see something. Okay. The subclinical is the symptoms that are not seen. All right. And the data in many of these diseases would show that the subclinical problems are the most economically damaging. Hence, there's a lot more under the waterline than what you realize. So a key question in the context of mycotoxins and nutritional toxicology is, what is underneath the waterline that I do not see? And that should be a question that veterinarians should ask as well as nutritionists in the dairy industry is, what don't I see that I need to start looking for and have an imagination of what could possibly be there? So getting back to the diagnosis, when it comes to mycotoxins, think of it as a process of elimination. All right. If there's a situation for dairy nutritionists that something ain't right, okay, you identify to a set of clinical signs. Okay, let's just say it's poor reproduction, or butterfat's low, or my intakes are bad, or just something ain't right. Okay, start listing all the potential causes of that particular situation, and then go through the process of elimination. Rank them from the most likely to the least likely, and start devising ways to either rule them in or rule them out. Okay. The veterinarians, can be helpful here. If the nutritionist has a good relation with the veterinarian, this could be real helpful, because a lot of times you can assign things to the veterinarian and say, hey, go hunt this one down. Tell me if it's in play or out of play. Now, the thing about on the veterinary side is postmortems are good to do. They're not done enough in dairy, in the dairy industry, in my opinion. But if you do them, they generally do not show more than some general signs of disease, such as gut irritation or inflammation, enteritis, or an enlarged liver. And as I said earlier, there's a lot of things that can be in play if you see that. One thing that this makes logical sense. I think this is the nice thing about the dairy industry compared to the beef industry is you have instant data. Okay, you've got a milk production, you've got components, you've got a daily data you can go and use to determine if things are improving or getting worse. And so by adding some of these mycotoxin absorbents to detect and looking for a positive change in the next day or two makes sense. I've done it myself. It certainly will let you know if you're on the right track. Cattle affected with mycotoxins generally do not respond well to veterinary therapy, which may be a clue. And we'll talk more about that at the end too. If there's an issue that's not infectious, then a lot of these veterinary drugs are probably not going to help. The veterinary drugs are designed for one thing, and that's to kill or arrest the growth of bacteria. If the problem's not a bacteria, the drugs are probably not going to do much, and you're going to continue to have a problem. So that's a key thing to understand when it comes to veterinary therapy. The last thing is chronic mycotoxin exposure initiates a lot of these adverse situations. Generally, it initiates a generalized inflammatory response and impairs rumen function. keep in mind that some of these mycotoxins have some pretty significant antibiotic effects. In fact, a lot of the antimicrobials that we use actually are from fungal or are actually by definition mycotoxins. So that's a good thing to keep in mind. But yeah, usually you see an impaired rumen function. In dairy cows, you'd see some, certainly some effect on milk components. And then, that generalized inflammatory response and immune suppression. Okay, so I'll show you a couple pictures here. This is a good example of what you would see if you post animals with just a generalized gastroenteritis. So I got my little pointer here. I think hopefully you can see that. So here's the rumen right here. You can see that shag carpet. Now you notice the redness there, some of that hemorrhage there. That's rumenitis. There's something, now look here, that it's not too much corn in the feed. It's not acidosis. There's something else in this feed that's causing that rumen wall to get inflamed. Okay, so you shouldn't see redness like this in the rumen wall. And then you follow it downstream. Okay, so here's your omasum right here. Folks, you probably recognize that with kind of that set of leaves of tissue in the omasum there. Note how red and hemorrhagic that is, and follow it downstream even more. Now we're in the intestinal tract over there. That does not look like healthy intestine. There's a lot of hemorrhage, striations there. So this is a generalized enteritis all the way through the GI tract. Something is irritating that mucosal layer all the way through. Now, some long, many times we'll see this with cattle that are exposed to a level of mycotoxins over a long period. It's kind of a chronic exposure, and that's where you'll start to see cows just start to look just rough, just beat up and rough. You'll see just this chronic inflammation. You get this from rumenitis. Pretty soon you'll start to see mastitis. Why would you see mastitis? Remember what I said about it blocks that communication between cells to migrate where the infection is. T2, for example, that's where if you have a challenge in the udder and you can't get white blood cells into the udder to fight it off, you're going to start having problems with clinical mastitis. Laminitis, you got toxins circulating in the blood. You're going to start to see those capillaries in the hoof start to constrict as a response to toxins. You're going to have laminitis there. Skin erosions. Remember, T2, especially those trichothecenes, are real hard on skin. They're real tough, and so you start to see sores. That's why I put this picture in here. Just sores all over the animal. That's not normal. You shouldn't see that. And then finally, this wasting, where you start to see certain over time reduction in some of these, the immune suppression. You start to see a lot of these inflammatory cytokines, interleukin-6, for example. You'll start to see a loss of appetite, wasting away a lot, body condition score drops. And so those are some of the things that happen with long-term toxin exposure. So just keep that in mind. Okay, so now we've kind of covered some of the main things to look for in mycotoxins. I want to spend the last few slides talking about other nutritional toxicology considerations. And I'll just want the attendees of this conference just to put this on the radar, because we're seeing a lot more of this here in the Midwest. I thought it'd be good to make the folks aware of it. First of all, I'll lead with this. It is true that trace minerals can be deficient. That's true. But trace minerals can also cause clinical and subclinical toxicosis if oversupplemented. Think back to Paracelsus. Anything can be toxic at the right dose. So some of these trace minerals can be overfed, and if they are at the right level, can be detrimental. And I'll explain. Copper and selenium toxicity is becoming increasingly detected in liver biopsy analysis in dairy cattle. That is true. We're seeing it in Iowa State. K-State's seeing it. I think if you talk to Jeff Hall at Utah State, he would agree he's seeing it more and more as well. There is too much copper and selenium that is coming into a lot of these dairy cows, and it's starting to create some problems. So I want the folks to be aware of that. So what does that look like? Let's just give a quick introduction to copper toxicity. Copper accumulates in the liver when it's oversupplemented, okay? Cattle that have been oversupplemented with copper They absorb it in the liver. The concentration in the liver increases. At this point, that animal is completely clinically normal. It is completely asymptomatic. They look fine, okay? But what happens in the right situation, stress causes we call it decompensation, all right? We don't know exactly the mechanism, but it's some stressful event. Something comes out of left field, stresses the animal, okay? And in calf-fed Holsteins going to a feed yard, you run them through the chute and you vaccinate them. Boom, there's your stressor. And what happens in decompensation is all those hepatocytes that have all this copper stored up release it into the bloodstream. It expels it rapidly in its ionized form, and that causes erythrocyte destruction, okay, or a hemolytic crisis. The animal all of a sudden just gets sick, incredibly sick, anemic, jaundiced. These red blood cell breakdown products end up causing renal failure. They essentially plug up the kidneys. In younger animals and calves and in calf-fed Holsteins, these steer calves, you'll see just a real significant immune suppression, which leads to secondary bovine respiratory disease. That is extremely refractory to treatment. You don't treat them out of it. And many times in a group of calves that has this, you could see 20 to 30% mortality within weeks. It happens that quick. In dairy cattle and lactating dairy cattle, what we've seen is late lactation liver failure. Okay, cattle are fine. You look at the lactation curve, everything's cruising along just fine. And then all of a sudden out of left field, they just go off a cliff. Okay, milk production falls off in a matter of a day or two. They go off feed. And usually they do one of three things. They recover, they dry off, or they die. In about equal proportions is what we've seen in some of these cases in some dairies. So just put that on the radar. It's just a bogey on the radar for the folks, just to keep that in mind. Selenium toxicity as well. Now, I understand there's been a lot of focus on selenium, certainly since I've come out of school, and I've been one of them that was pushing a lot of selenium, saying, hey, we got to make sure we got enough selenium. It's true, but again, anything can be toxic at the right dose. So when we see acute toxicity with selenium, it's usually due to I'll call it the misuse or the overuse of selenium injections. A lot of selenium injections, a lot of mineral injections. I get it, it's fine, but you can overdo it. Chronic toxicity is more commonly associated, what we've seen, with oversupplementation in the feed. I will make a comment with the same thing is true with copper. Remember, I think the folks would be asking, why is this happening now? And I will answer that question with another question, which is, where do you think all the copper used in copper sulfate foot baths went over the last 50 years? It went somewhere. And so could it be that we're building up a lot of these trace minerals in the soils and it's circling back through the basal diet? I don't know, but it's possible. It's an element. It doesn't just disappear and evaporate. It's going to go somewhere. So getting back to selenium toxicity, the signs of chronic toxicity include, lameness, laminitis. Sound familiar? Loss of body condition. Sound familiar? Rough hair coat, hair loss, dermal lesions, sloughed hooves. There's the old famous reproductive dysfunction that includes a lot of potential causes there. Abortions. So again, note the similar non-specific clinical signs that we attribute a lot to certain things like mycotoxins, laminitis, lameness, poor reproduction, liver failure, immune suppression, abortion, red blood cell, erythrocyte destruction. The drugs don't work. So my point is keep an open mind when it comes to toxicology in dairy cattle. There are more possibilities than just mycotoxins creating the non-specific clinical signs. So just remember, any substance can be toxic at the right dose. So keep that in mind. I hope that helps. If you work with your veterinarian. One thing, if you do suspect anything might be going on with liver, that I'll just add this. It's you really cannot rely on any sort of blood parameter for copper to tell you much. You got to go and get a biopsy of the liver to really know what's going on. I would even say probably the same thing for selenium. I think you can do some whole blood selenium and probably get some conclusions that would be fairly accurate. But those liver biopsies can tell you a lot. If you can get a veterinarian to work with that, do some liver biopsies, good information. Lastly, this will be in the notes. There's some references here for the folks if they want to dig in deeper. There's some good stuff out there, but note the dates on it. A lot of this is pretty old, 20, 30 years old. So, some of this came out when I was still in high school and grade school. So we need to, it's good to, keep working at this. So again, thank you for listening. It's kind of a unique experience doing this with video. And I appreciate the folks at Penn State again inviting me. And I hope it was educational. Thank you.